Thank you very much. It's my pleasure to introduce 9 reports of the Secretary General and the High Commissioner to be considered under item 3 of the agenda. Due to time constraints and in the spirit of contributing to efficiency, my presentation has been substantially shortened. I'm not sure if I'll make 5 minutes, but I'll do my best. But the full version of the statement will be posted on the extranet. Due to the liquidity and financial crisis facing the United Nations, 3 reports have not been delivered at this session as initially foreseen, as the High Commissioner informed the HRC in his letter of 16 June. First, the report of the Secretary General and the High Commissioner on the right to development, which provides an overview of activities undertaken by our office to promote and realize the right to development, and an analysis of the impact of unilateral coercive measures and the non-repatriation of funds of illicit origin on the right to development, a theme I'll note has resonated in the economic, social, and cultural rights discussion this morning. The report underscores the severe and multifaceted impacts of unilateral coercive measures on human rights. States are urged to refrain from adopting measures that are not in accordance with international law and recommends robust human rights safeguards, including through human rights impact assessments. States imposing such measures should establish broad, effective humanitarian exemptions to minimize overcompliance and facilitate the work of humanitarian actors. The report also highlights how the inability to recover and return illicit funds deprives countries of vital resources to achieve sustainable development. The report of the High Commissioner on the Rights of Indigenous Peoples provides an overview of the development and actions contributing to the promotion and full application of the UN Declaration on the Rights of Indigenous Peoples. The report reveals persistent, systematic violations of Indigenous peoples' rights, with at least 42 Indigenous human rights defenders killed in 2023 across 11 countries. The report also brings to the fore the unique struggles of Indigenous women and girls and the impact of environmental degradation on traditional livelihoods. The report calls on states to strengthen legal frameworks for land protection, implement robust consent mechanism for territorial projects, enhance human rights defenders' protections, and ensure meaningful Indigenous participation in environmental decision-making and implementation of other recommendations. The Office's update to the technical guidance on the application of a human rights-based approach to the elimination of preventable maternal mortality and morbidity underscores that this deeply alarming phenomenon remains a lethal expression of gender-based discrimination. In certain sub-Saharan African countries, women are up to 400 times more likely to die from preventable causes related to pregnancy and childbirth than women in high-income countries. These women are not dying from untreatable diseases, and their deaths are not inevitable. They are dying due to a lack of political will to address the root causes of maternal deaths by upholding women's human rights, especially the right to sexual and reproductive health and the rights of the most marginalized populations. States should address maternal mortality and morbidity with a new sense of urgency through bold systemic change and solidarity. Surviving pregnancy and birth should become a reality for all, not a privilege for few. The annual report of the Secretary General on the death penalty examines the human rights implications of the death penalty. Ghana, Zimbabwe, and Zambia either abolished or limited the death penalty during the reporting period. The GA's 2024 resolution on a moratorium received record support of 130 states. Yet a shrinking number of retentionist states increased executions. In 2023 and 24, Iran, Iraq, and Saudi Arabia accounted for over 90% of known executions, with Iran responsible for 64%. Executions for drug-related offenses also surged. New execution methods, such as the use of nitrogen gas in the United States, raise concerns as well. The report underscores systemic discrimination in the application of the death penalty and the persistent violations of fair trial rights. States are urged to abolish the death penalty or adopt moratoriums, uphold fair trial standards, prohibit executions of juveniles and persons with disabilities, and refrain from applying it to crimes that do not involve intentional killing, such as drug-related offenses. The High Commissioner's report on the rights of the child and the violations of the human rights of children in armed conflicts outlines the legal framework protecting children in armed conflict, identifies barriers to effective protection, and offers recommendations to prevent violations, strengthen safeguards, support recovery and reintegration, and ensure accountability. The High Commissioner urges states to take urgent, coordinated, and sustained action, including, first, ratifying and implementing key legal instruments; second, embedding child protection into military policies; third, providing timely gender and age-sensitive support; fourth, strengthening child protection mandates in peace operations; and fifth, ensuring accountability for violations and treating children associated with armed groups primarily as victims. In addition, ensuring safe humanitarian access, supporting reintegration, and involving children meaningfully in all stages of response are essential. The High Commissioner also urged the Human Rights Council to mainstream children's rights in its work. OHCHR's study on the human rights and the social reintegration of persons released from detention and persons subjected to non-custodial measures emphasizes that reintegration is a human rights imperative. Holistic reintegration models in Austria, Costa Rica, and India demonstrate the value of coordinated evidence-based approaches. Public engagement initiatives in Singapore and Czechia show how inclusive narratives can reduce stigma. Women-led efforts in Colombia and youth-led programs in Trinidad and Tobago highlight the importance of involving formerly incarcerated persons in programs. In Zambia and Mexico, grassroots NGOs founded and led by women with lived experience are offering gender-sensitive solutions tailored to women's needs. In Australia and Canada, culturally relevant community-based strategies that empower Indigenous communities and respect their legal traditions and governance are being developed. The report calls for institutionalizing a human rights-based approach to reintegration, reforming punitive practices, including the use of criminal records and fines, and expanding non-custodial measures, among other recommendations. Next, OHCHR's evaluation of the implementation of the fourth phase of the World Program for Human Rights Education provides an overview of national efforts to advance human rights education for youth between 2020 and 2024. The report emphasizes the importance of embedding human rights education with broader sectoral approaches. This approach enables more strategic use of resources and fosters long-term sustainable impact. The report calls for increased efforts to ensure the inclusive and meaningful involvement of youth, not just as beneficiaries, but as key partners and decision makers. Human rights education and its promotion of the principles of solidarity, equality, and belonging to a community, common humanity is crucial to building inclusive, cohesive, and resilient societies and represents a beacon of hope for us all. OHCHR's study on human rights monitoring in the context of migration underscores the urgent need for robust, systematic, and comprehensive monitoring of human rights across all aspects of migration and border governance. Monitoring enables states to understand the human rights impacts of migration laws, policies, and practices, and it prevents harm by ensuring independent scrutiny and supports accountability for human rights violations. The report includes promising examples of integrated monitoring into migration governance, demonstrating that such integration is both achievable and instrumental in advancing effective rights-based migration governance. Key recommendations to states include integrating monitoring in legal and policy frameworks, safeguarding the independence and adequate funding of public human rights bodies, facilitating unhindered access for independent monitors, and putting in place institutional channels for follow-up findings. The study also calls for the Human Rights Council to support its efforts to strengthen independent human rights monitoring at international borders. Finally, OHCHR's report on discriminatory laws and policies, acts of violence, and harmful practices against persons with innate variations in sex characteristics, as presented earlier this session, examines human rights violations faced by intersex persons, including infanticide, violence, medically unnecessary interventions performed without consent, high levels of discrimination, and barriers to accessing justice and remedy. The report highlights promising practices by states and other stakeholders across all regions, including banning medically unnecessary interventions on children without consent, ensuring independent oversight to distinguish medically unnecessary or non-urgent interventions from interventions that are needed to preserve the life and health of the child, reviewing medical protocols, providing access to counseling and information for intersex persons and their families, and collecting data in line with human rights standards and supporting intersex civil society organizations. The report also emphasizes the need to combat hate crimes, incitement to violence, and discrimination based on sex characteristics. Thank you for your patience.